Good evening and welcome to Health Check, where we talk about your health, which is your wealth. Tonight, we'll be exploring a condition that is common in women and can be alarming. That is abnormal uterine bleeding. It's a bleeding from the uterus that is longer than usual and can be irregular. It can also cause health complications if untreated, hence the importance of seeking medical attention to identify the cause of the bleeding so as to get appropriate treatment. Our guests tonight are experts on this and will be informing us more on the causes, diagnosis and treatment options, plus more. You need to tune in and engage with us. We also will be having some special announcements at the end of this show, so you need to stay tuned as we welcome on set this evening Dr. Kireki Omanwa. I hope I got that right. He'll be letting us know if I've done well, who is a fertility specialist and also the Kenya president of Kenya Obstetrical Gynecological Society of Kenya. We're also glad to be joined by your favorite resident gynecologist and also the founder, a gynecologist and obstetrician, and also the founder of Dr. K Foundation. Yes, I had to get that right. Dr. K Foundation. Her name is Dr. Karen Muthembwa joining us tonight. So engage with us. Our SMS line is 22232. That is 22232. You can also get us at Hope TV Kenya on Facebook and YouTube. Our WhatsApp line is 0708 222 323. Good evening. My name is Grace Mutis and welcome to tonight's edition of Health Check. Ensure you share this link with someone who will benefit from it. That's your mother, your aunt, your little sister, your cousin, and let's engage. At this point, allow me to turn to our guest and introduce them. Good evening, Daktaris.
Good evening.
Good evening.
I've really longed to say that. You're doing well?
Yes.
Okay.
Yes.
Good to see you. Because we are two ladies on set and the gentleman joining us, allow me to ask him to introduce himself officially and tell if I've gotten your name right, and tell us a little bit about what you do, especially with the Obstetrical Gynecological Society of Kenya. Yes.
Thank you. Thank you so much for inviting us to the studio today, and especially the topic that you have chosen for us to talk about is a very important topic. Yes, you did get my name correctly. My name is Kireki, Dr. Kireki Omanwa. I'm a consultant obstetrician and gynecologist. You asked what is obstetrics or what do we do with obstetrics. Gyne, I think most people will know, he's a gyne, so we know that he or she deals with issues related with women problems, health issues related with women problems. But an obstetrician basically deals with from the time a woman gets pregnant until the time the woman delivers. So we take care of pregnant women and we deliver them and also sort out any complications that can come from that state. I am a fertility specialist as well. And we know that we have a big problem with the issues of getting babies. So I deal with couples who have issues, have been trying for 5, 10, 15, or even sometimes more years trying to have a baby. So we try and diagnose and offer solutions to the problems that they have. Apart from that, from where I sit, I'm the president of the Kenyan Obstetrical and Gynecological Society. So basically, this is an organization which sort of oversees all the obstetricians and gynecologists in this country. We are about, give or take, about 500 of us. So I sit there administratively as the president. And I'm glad to be here. Today I've walked around your church,
Yes.
and I'm happy to be here.
Welcome,
Yes.
Dr. We're glad to have you. And you mentioned something that every woman is really keen, fertility specialists. Let's not even go there.
Let's not
but
go
I
there.
know questions will come, so drop them. We'll see if we can squeeze them around there. And of course, our Dr. Karen, how are you?
I'm fine, thank you, Grace. Very happy to be here.
Yes.
As usual, one of my favorite things to do is being here and teaching.
Yes.
Yes, so my name is Dr. Karen Muthembwa, a resident in obstetrics and gynecology. That means I'm finishing my final year of my master's, doing my obstetrics and gynecology. One of my lecturers is Dr. Kireki,
Oh,
actually
wow.
also lectures us.
Yes.
A very good lecturer. And then also the founder of Dr. K Foundation, which we just started in January. Where we teach about reproductive health, we talk to teenagers. Our hope is to give them the best reproductive health information possible. Yes.
Interesting. What's your target audience, or an old mama like me can join?
Anyone can join. Anyone. There's a space for everybody.
Yes.
Yes.
And my daughter can also join.
And your daughter can join. We'll just put you in different groups. Yes.
You've had. Thank you. Welcome, Dr. Karen,
Yes.
together with Dr. Kireki. So we are having an interesting discussion tonight about abnormal uterine bleeding. Maybe let's start there. Let's go with Dr. Dr. Kireki. What's that? Help us define what abnormal uterine bleeding is.
That is a very interesting topic because in our textbooks of gynecology, it actually occupies a good chunk of the books that we've trained on, and other people are training on. So when you talk about abnormal uterine bleeding, it is anything that is not normal. How does it start?
Yes.
We normally look at, first of all, when a patient comes, the first question that we ask is, when was your first period?
Yes.
And usually it's 13, 14, 15. Sometimes they don't remember. So we ask maybe, which class were you in? And they say, oh, I was in class 8. This one, they will never forget, that
Yes.
first time.
Yeah.
So the first monthly period, when was it? And the next question is, how are your periods? And most of the time is they are regular. So if they are regular, what does that mean? Do they come every month? Say yes. Okay, if they do come every month, so how often are they? That is 28 days, 26 days, 30 days. So basically we are talking about from when a period starts till the next period. So that is the cycle,
Yeah.
a period, menstrual cycle. So the next question would be, how many days do they last? Or they last maybe 3 days, maybe 5 days, but you find other women saying they last 7 days, they last 10 days. Already that is a red flag. When the cycles are too short or they are too long, that is another red flag. And then now we ask of your periods. Are they heavy? Are they painful? And so on. Some say they are normal, which is okay. And by normal, what do we say by normal? Or when they are heavy, what exactly do we mean by that? So when they're heavy, we ask, okay, so how many pads do you use in a day? And you see, for me as a gynecologist, that is my bread and butter.
Yes.
My colleagues who are not gynecologists would be very shy to ask about a pad, but we know about the pads and which pads, kuna maxi and so on. Hizo tunazijua.
Thick and the thin.
Yes. So we ask, okay, so how many pads do you use when you say they are very heavy? Or sometimes I use 5 pads, I use 7 pads in a day. Sometimes I even use a towel, and sometimes it overflows. So that is another red flag.
Yes.
Are the periods painful? Yes, they are painful. And then we ask, so when does this pain start? Does it start a few days before the show? Or does it start maybe just when the period starts? And so on. That also is an indicator whether the periods are normal or abnormal.
Yeah.
And then the last question we want to ask is, are there any clots? Yes, there are clots. Clots are not supposed to be there.
Yeah.
So it means that there is a problem as well. So when you talk about abnormal uterine bleeding, is anything that is not normal, where normal is, let's say 26, 28 cycles, 28 days cycles, 3 to 4, 5 days cycle, the flow. And then when it comes to characteristics, it can be average or maybe heavy at the beginning, but then it tapers down and it stops. No pain. Cramps, usually most women will have cramps. But pain, because there can be some debilitating pain, is not supposed to be there.
Yeah.
Clots are also not supposed to be there. Now, when we talk about, when they say that now, we start thinking, what could be the reasons of this abnormal uterine bleeding?
Yes.
There can be something we call a polyp, which is just a growth in the cavity. The cavity of the womb is actually where the baby grows, or the lining comes out when you're having a period.
Yeah.
So that is a cavity. It can be a polyp, a small growth on that lining. It can be what we call a submucosal fibroid, or we talk about fibroids, and this is a subgroup of fibroids. It can be endometrial cancer, for example. It can be cervical cancer, for example. You may have other diseases as well. When you have a problem with clotting, your blood does not clot when it's supposed to clot, and because of that you have very long and prolonged periods. You may have other diseases as well. So the diagnosis or the reasons can be from here to very far away. So abnormal uterine bleeding, no lady who is menopausal should bleed. That is already abnormal.
That's at what age?
At what age?
Yes.
When you talk about menopause, usually around in this part of the world, women hit the menopause around late 40s, early 50s.
Yes.
So you find the periods start becoming irregular, inakuja, inapotea.
Yes.
And then when it comes, sometimes it's heavy, and then sometimes it's light, and then it goes for a walk, and then it comes back after 3 months, again after 6 months, and then it disappears.
Yeah.
Now, once we have hit that age, there should be no periods, or there should be no bleeding.
Okay.
So when there is bleeding and you're in the menopause, that is absolutely abnormal.
Okay.
Let's say you are 80 years old, and then our moms, our grandmothers, they say, something, I saw something there. It is not supposed to be there. That is abnormal. Absolutely. When you have a patient who is bleeding in between the periods, that is also not okay. There could be something with the hormones, and so on. There could be, after intercourse, for example. That is also not normal. So there's a wide range of reasons why we call this abnormal uterine bleeding.
Okay. You're talking and I'm thinking, wow, check. You need to do something. And I know that's what my viewer is also thinking.
Yeah.
If baby doctor is mentioning something and you're wondering, what? I think I need help. Please talk to us. Our WhatsApp line is right at the bottom of your screen, and also our SMS line. And remember, we are live on Facebook and YouTube. Our handle is at Hope TV Kenya. Drop that question there now, so that in the next few while as we go on a break, we'll come back and we'll sampling your questions. Now, Dr. Karen, you know Dr. Kireki has just talked, and you deal with girls and women, in Dr. K Foundation. So what are some of those things we think is just normal, but yet could be
It's
falling
not
in this
normal.
category?
Yeah.
Especially talk to parents and our young girls.
Yeah.
We assume they should know.
Yeah.
I think the fathers also should be listening to.
Yeah,
Fathers,
yeah,
yes,
yeah,
yes,
yeah,
yes,
yeah. In
yes,
fact,
I
you should
agree.
just call all of them to join.
Yes. Yes.
Right. Yeah. So when it comes to menstrual health, first of all, it's a very important topic, as you've said, because it starts from when a young girl has started puberty, and at the end of that puberty, they're supposed to end with menstruation. That is like the hallmark of, yes, now you're really into, your puberty is well done, right? Yes. So we have, the time when a young girl is supposed, or an average time when they're supposed to have your menstruation. So if we start with very early, you'll find that some, because of the change in our diet and all that, might start earlier than usual at around 8 years, 9 years. But the average area is around 12, 13 years old. But it should not go beyond 16 years if you haven't even started developing. Yeah. So that's one of the things that most people might not know, because you'll have a young girl who's growing and she's 18, she hasn't started developing breasts or what, and no, she's not had a period. Yeah. So it's something to note. By 16 years, most of the girls have developed a period. So that's usually one of the things that parents should look out for. So by 16 years, they should have a period. Then you ask yourself, is this period normal or abnormal? Because, well, you'll have a young girl also starting her period. Let's say now she's starting at 14, 15, and she's having a period that's lasting around 3 to 5 days. It can come between 2 to 5 days, and that's okay. The average flow should be around 30 mils, in a way that when you're taking, it's not easy to measure 30 mils or 50 mils at home, yes, but you can see how many pads they're using. As a young girl, there's, they start with the small pads, and then you wear it, should not be soaked, at least change at least every 4 hours in a day, and should not be soaked. Yes. So if there is any soaking of that pad, if there is now maybe just droplets, they're just getting one drop and that's it. They're not asking for more pads. Maybe you bought one pad and the next one is 6 months later. But it's good to note that at the beginning, young girls might take some time to get a regular flow. Yes. So it's possible that they can start a normal period, then it stops for some time, months, and then when it comes now regularly before it picks up a regular cycle. So at the beginning, it's possible that you can have a girl who's not having an exact regular period, but eventually it regularizes. So it's good to note that as well. In terms of pain, there's mild to moderate pain for most of us who grow into having periods. But again, pain is never normal. And again, you don't want to assume, because people have different thresholds for pain. But there's that pain that if it disrupts her life, she's not able to go to school, she's in class, she's crying, maybe she gets depressed, anxious, even during their period, that's something to check about, because pain might be just one of the early signs of conditions that develop later on, even in life. So that's also one thing. There's something like PCOS. PCOS also starts when they're young. So they only notice later on, but the signs and symptoms usually start very early. So you'll find like they never regularize their period. It should come to regular, but now at this point, then having a period after 3 months or after 6 months, you can't tell that you're supposed to have a period on this time. So you can't be able to predict. So that's a sign that there could be an issue with the cycle. So those are the things people should look out for maybe women who are in their reproductive age now, well grown, let's say above 20, signs of if you're having too much, as Dr. Kireki has said, too heavy. Heavy means you're either putting even a towel, and when a woman tells you they're bleeding, they're really, really bleeding. Believe them. Believe them. Sometimes it's like a crime scene, being in the toilet, and when you look back, everything is bloody. So that is something to look out for. If you're having an abdominal distension and you're having heavy periods, that also could be a sign of something, because there are multiple things that cause abnormal uterine bleeding.
Thank you for that. So a lady walks in, Dr. Kireki, and I'm just fine, I'm just coming for gyna check. So at what point do you say, I think you have abnormal uterine bleeding, and what are some of the things that you need to do to help regularize them?
First of all, I need to talk to this lady. I need to know her name. I need to know where she comes from. I need to know her date of birth. These are very important things. First of all, I need that connection with this lady. So the first questions, as I said, is first period. That is standard for all gynecologists. First period, when did you have it? I had it 13, 14, as Karen has mentioned. How are the periods? They are irregular, okay? That is a red flag. What do you mean by irregular? It means that sometimes I have them every 14 days, for example. Or sometimes I have them. I had a patient who had periods every 2 years. So that is absolutely abnormal. It can't be that way. So that is a red flag. So if we remove these extremes, 2 years and maybe 14 days, let's try and get these ones in the middle here. How often? Anything over 35-day cycle is abnormal. So we need to take, put a special sort of marker there. The length of the flow, anything over 6 days, 7 days, it goes to 10 days, that is a problem. The characteristics that Karen has mentioned here, the heaviness, the pain, the clotting, and if they are there, if the clots are there, so we ask other questions. Do you have any other problems? Do you feel dizzy sometimes? Do you feel weak sometimes? And they tell you, yes, sometimes when I have my periods, I actually can't function. That is a problem. Do you have pain? She mentioned the pain. The cramps can be there, but most of these cramps are taken care of by simple analgesics, paracetamol, ibuprofen, and so on. But when a patient says that even these medications don't help me, that is a red sign as well. And then, do you have any other issues? For example, when you go to the bathroom, are there any pressure? Do you feel any pressure? He said, actually, yes. When I go to the bathroom, when I'm doing a short call, sometimes I need to rush there. And then when I go there, whatever comes out is not commensurate to what I was feeling. That is another red sign.
So in short, if it's short call, I feel as if my bladder is really full.
Yes.
But when I sit there, it's just this small.
And then when you go out, after a few minutes, you want to go back in. And then it's still not the same. So now this one connected with the heavy periods, connected with the clots, connected with the dizziness and the length of the flow and how many pads she uses. These are all red flags all along. And we are still collecting information. What about when you have intercourse? If she's married, she has a partner, she has an active sexual life. Said yes, sometimes I do feel some pain or some discomfort, or sometimes when I go for a long call, I also have issues. I also feel like I need to go, and then when I go, nothing really comes out, or again, whatever comes out is not commensurate to what I was feeling. So all these are red flags all along. So the next thing we want to do is obviously to take the history of the family. Were there any similar problems in the family, and so on. So once we have finished with all this, now we go down to the diagnosis. What tests do we need to do?
Yes.
We need to do a simple test, a blood test. We need to look at her blood levels, we call it. That is the hemoglobin. So you find in these patients who have very heavy clotty periods and so on, you find that their hemoglobin or the blood level will be low. Anything less than 10 is something which we need to find out the reason why. And then now that will actually connect with other symptoms, the dizziness, the feeling tired, maybe lack of concentration, and so on and so forth.
Yes.
So that one we know there is an issue. The next thing we want to do is to do a scan, an ultrasound scan.
Yes.
And ultrasound scan, we can either do it through the abdomen or through the vagina, what you call transvaginal ultrasound scan. Both of them have their own good and not so good issues. The abdominal one, if there is a small problem or the problem is not so big, you may not be able to see the cause very clearly.
Yes.
Because first of all, we tell you, enda ukunywa maji kwanza.
Exactly.
Ukisha kunywa maji, when you feel like now you can't, alafu uje. And then now the worst thing is that we tell you kunywa maji, and then when you really feel like you want to go to the loo, you can't go. And meanwhile, there is a queue here waiting to see Karen.
Yes.
So it becomes a challenge.
Yes.
So that is one of the biggest problems. The other one is a lot better. The transvaginal one, you don't need to feel your bladder. And the beauty of it is that we are very near the womb. Actually, we just touch the womb and we can see everything in magnification. So even if there is a small problem in the cavity, for example, which the transabdominal one could not have caught, this one will catch it.
Yes.
But then, of course, the discomfort is that you know what it is.
Oh, yes.
Yes, I don't even need to go there.
Intrusion of privacy.
Yes. So once we have this, because broadly this is the information that we need. So we've done bloods and we've done radiology. So once we've got this, we look at the lining, for example, the lining, what you call the endometrium, the lining is thicker than it is supposed to be. There is a problem there. Now, when you connect this with the other symptoms, you find there is something, for example, in the lining. Or maybe there is a big growth, fibroids. Fibroids, 40 to 60% of women of African origin have a problem with fibroids. So in their reproductive period, they will have a fibroid. It can be small, from a few millimeters, it can be many, and even to very, very big dimensions, 15, 20 centimeters and so on. So then we now start putting the bits and pieces together. That heavy period, those clots, that feeling weak, feeling dizzy, HB is low, and now we have this picture from here. We have fibroids, for example. You have something growing in the womb. Now we have a tentative diagnosis.
Yes.
And the tentative diagnosis is, for example, you have fibroids, or you have a cyst, for example, on the ovary, or you have something growing in the womb, and so on. Now with this, we can sit down with the patient and say, look, these your heavy periods, this is what we think it is. And this is how we can manage this. We can either manage this medically or we can manage this through surgery. Most ladies don't want to go through surgery. I also wouldn't want to go through surgery. So most of the time, we may want to manage this medically first, as we give the patient time, to think about, what we have suggested. And if surgery has to be done, then it has to be done at an optimum moment, and it should be the last thing that we should do. We try conservative management first before we come to surgery.
Okay. Wow. I like it that surgery is not the first option.
No, no,
no.
There are other ways you can go around it. We are talking about abnormal uterine bleeding, our topic of discussion tonight. And I'm hosting Dr. Kireki Omanwa and also Dr. Karen Muthembwa. We are looking forward to receiving your questions and comments. Our SMS line is 22232. Our WhatsApp line is 0708 222 323. That's where you can get in touch with us. When we come back, we'll continue this conversation, and we'll also be sampling some of your questions and comments that have come through. Keep them coming. And men, please, maybe your wife has been going through stuff and you're wondering, I'm not sure. The doctors are here. Please ask all those questions and you'll be answered. And of course, I'll be interested to know, how can husbands come in to support their wives who are going through this, or their daughters?
Or their daughters.
Or their relatives who are going through this.
Yeah.
So let's have this quick break. We'll be right back.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking,
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Welcome back to Health Check right here, Top TV Look and Live. This is the place you need to be every Tuesday as we bring you great conversations regarding your health. And tonight you're talking about abnormal uterine bleeding. And of course, I'm hosting Dr. Kireki Omanwa together with Dr. Karen Muthembwa. Do you have any question? Keep them coming. In a short while, we'll be getting to them. Our SMS line is 22232. Our WhatsApp line is 0708 222 323. And we are live on Facebook and YouTube at Hope TV Kenya. Ensure you share this link with your loved ones. So let's go back. So how can a husband come in to support their wife? How can they support their daughter? I'd love to start from a female's point of view. You speak to men, they'll take you serious.
Yeah.
Dr. Karen.
First of all, I want to appreciate all the men here, because we have those ones who are actually watching for their wives and their children.
Yes.
How can they come in? First of all, what they're doing right now is, number one, first learn about menstruation. Don't be afraid, because this is something that affects both a lady and a man. It's not just for women. The men also have to also know when their wives are having their menstruation.
Yeah.
Usually they know. It's something that we don't talk about every time, but they will know, okay, this time we are having our period. We are having our periods.
Yes.
So it's good to understand, how is a menstrual period supposed to be? How is it normal? When is it abnormal? Because some might have wives who they're taking care of. You see, you have you can have a husband who's taking of his wife who's sick.
Yes.
So they also need to know when something has gone wrong, because there are those people who really are present for their partners. So that's the first thing. The second thing is to make sure that you have discussions, conversations about this. Let it not be a taboo anymore. about having a conversation about a menstrual period. This is where shame comes in, because shame can be in different ways. It can be in you as a woman, where you cannot even say that you're having a period, that you can't ask for money for a pad. Instead, you go and use something else that's not clean for you. So that's one of the things. Then the external shame is where we have people making you feel bad because you're having a period, or maybe they don't give you that respect as a woman because you're having a period. For example, if I walk here right now and I have a patch on my back, and because the men are afraid to tell me, another lady, everyone is just afraid. You know, this is a normal thing. So open-minded conversations about menstruation, and also allowing your children to also be free to talk to you about it, because one day you're going to be the one buying that pad for you, but you won't know which one to buy for your daughter, because there's that one you can buy for your wife, there's that one you can buy for your daughter. So having that conversation will remove that not very sure feeling when you're at the supermarket, and even when you're going to pick, you're running away from everybody. You have to wait until that lane is empty so that you can grab one. But you still have to put it on your trolley, you know. So having open conversations is also one of them. Yeah, maybe Dr. Kireki can add to that, but yes.
As you also share with us, is the treatment standard or it varies per person?
Let me start with that one. It varies.
Okay.
It all varies completely.
Yes.
And I think this depends on the degree of knowledge and the degree of openness that we have in this area. I must say that for us as men, not me as a gynecologist, but men in general, anything blood is a challenge. And then when we know that this blood is coming from a different place, it makes it even worse. Because you don't even want to imagine that that is the way it is. That is the way it is. Now, and then when you see this lady, you remember there's a senator who went to parliament with her, and it was a big issue. It should not be. But she did something fantastic. People started talking about this. We're talking about this. It is not something which is abnormal. And by the way, all of us are here, even the men, all of us are here because of that period.
Very true.
Yeah.
It refused to come, then we
It refused to come. That is my way. So we should actually be grateful, grateful for that. So I think the common knowledge about these periods, that is something which is normal, that it is something which signifies that a young lady now has, moved from being a little girl to somebody mature, and that actually her activity in some areas can actually make her life go south. All this is very important for us as men and as fathers as well. I buy pads for my daughter, and my daughter tells me, "No, Dad, I'm having my periods." Oh, it's okay. I don't see a problem with that. And can you buy me pads? I say, which one do you want? And then I go and I pick. And then when you're standing, just like you said, you don't wait. Me, I just said, naweka hapo, iko hapa, Billy.
You're one of the few.
Wake up. Pesa ngapi? This is so much. And then you see that connection that I'm actually doing this for my daughter. It should be something which is normal. So we men, we should actually start, sort of. And again, this discussion that we are having is actually, to a certain extent, is destigmatizing the problem of periods and menstrual hygiene as well. So if you don't buy these pads for your daughter, and a boda buys them for your daughter, honestly, or a boyfriend somewhere at sijui nini, and then you see these things are not for free. Atanunua, and then there'll be payback time at some point. And then after that, there are also a lot of issues. So it is nothing, it is a normal thing, it happens, and during that time, our ladies are, quote unquote, incapacitated, but we should support them. For those ones who have very heavy periods, know which pads to buy. And if they are very heavy, it's good they are listening, and they should hear that if the periods are longer than 7 days, then they should say, ebu tuende tukaone Dr. Karen, tuende kwa Dr. Kireki or a gynecologist. Let's see what the problem is. If there is pain, and that is one of the biggest issues. Sometimes men, we are used to unaletewa chakula mezani, you know, unapikiwa kila kitu.
Yeah.
But when she tells you, you know what, I'm not feeling, it is painful. Kwani si ni periods tu? Kwani what? Kwani
si ni mkono inapika?
Si ni mkono, ni mkono inapika, you know.
Yeah.
We should be sensitive to how the feelings of our daughters, of our wives, our sisters, and so on. And then the other area of support is when you take them to the gynecologist.
Yes.
Sit there with them. Wengine wanakuja wanakaa kwa reception. They even don't want to be identified with them. But go in there and do a bit of research, have a discussion with the doctor. And then there is something which ladies love about that. It shows that actually this gentleman cares about me and cares about my health. He is there, he's asking informed questions, and you know, he's active. So this, I think, the support that we can, the moral support, the financial support, and also that buying those pads. And if she's going to hospital for, you know, for further treatment, be there as well. I think when we do this, it will be a lot better, and our ladies, our young girls, we'll have a certain standard. You know, but my father used to buy this for me, so what is the problem? My father bought me, kwani what is the problem? Even you can buy. So I think these are some of the things which can do. It will not start immediately. Itaenda tu pole pole. You know, lazima mtupeleke pole pole.
And I've wanted to ask Dr. Karen, before we get to the questions that are coming in so fast, what are some of the things as ladies we do that hinders the men from offering the support, you know, either to the daughters or to their wives when it comes to
these things?
Yes.
Yeah. Sometimes, by the way, the problem might be starting from us because we, as I said, you can start blaming you know, because of the knowledge behind what menstruation is about, and you know, as we were growing up, there are things we were like, don't tell your dad, or even like when my first period, I don't think I even talked to my dad about it. You know, I think maybe my mom told him. Eventually, he started buying for us pads, but of course he'll tell us, come, we go and pick it. So you pick it for yourself, but he pay. You know. But that's, I guess, that time it was, you know, the way it was. We just don't talk about it. We don't freely, we accept some of the things that are said to us. For example, you're told that you're unclean. You know, there's that belief that as long as you're having your period, you're unclean. Then also, for us, we accept it, and we don't necessarily learn and unlearn some of the things that we were taught a long time ago. So if we're able to communicate with our partners, our brothers, because even our brothers sometimes, like for example, if I'm having some pain on the back, I just tell him I'm having pain, and then he will joke and say, is it your period? You know, so we can joke about it, but it's not in a way that will make me feel bad. You know, it's just because I know about it. It's okay. It's okay, you know. So having that conversation, and then also spreading this information that is wrong to other women and our children, our future children, for some of us, you know, giving them information that is not correct about menstruation, and having conversation with the right people, particular male people around you, then that's one of the things that we don't do right. But otherwise, I think we are trying. We have been trying to remove all those beliefs and myths about menstruation. And yeah, we want even everybody who's watching today to be able to speak to some, because all this can be like wildfire. The way COVID spread, this information about menstruation, it's okay to have a conversation with everybody about it.
Okay. Wow. Let's sample a few of your questions that have come through in the next few minutes at Hope TV Kenya on 22232 on 0708222323. This one writes and says, I had a problem in 2021. It got so bad that while still on medication, the blood would flow to the ground while on my way to work. It was found to be adenomyosis. My HB had dropped to 6.0 on obstetrics. I have to say that slowly. My niece lost her baby in December. I think that's a separate question. A gynecologist admitted her to hospital while on high blood pressure. We requested to do surgery and save the baby, who was 36 weeks, but she ignored. She took her to theater on the 4th day when the baby was already dead. The pain is still raw. My question is, are doctors trained on standard procedure? Pain there. Let's start with the first one.
Yeah, let me start with the one for adenomyosis, because it's one of the causes of abnormal uterine bleeding. in terms of, and it's good that she went to the hospital and they found out what the problem was. So for those people who don't know what adenomyosis is, we've discussed, I think, endometriosis before, where you have the tissues inside the womb. Now the one where it cushions the baby when the baby is growing, that tissue is called the endometrium. That's where the placenta holds onto. It's like a cushion. Let me use an example. The inner layer of the uterus, that part is called the endometrium. So the tissues can be found in other places for some people with that condition called endometriosis. Other places where you find that tissue on an ovary, that tissue on something, somewhere inside there, where the intestines are. Some people will get at the umbilical region. So that is the tissue that still bleeds when you're having a period every month. So what happens is that that tissue, when it bleeds, it irritates the area around that place. So you have bleeding inside, maybe on top of the ovary or inside the abdomen, and it causes irritation in the abdomen, causes very severe pain. And then, of course, other things like you form adhesions and difficulty in conceiving because of all those processes that are going on with endometriosis. Adenomyosis is like endometriosis, but now it's not in the inside the endometrium. Now it's at it goes into the layers of the uterus, now the muscular layers, and when it conglomerates there, that's the easiest word that I can use. It forms now what causes adenomyosis, and guess what? It bleeds as well. Every month you're supposed to bleed, it bleeds in those muscles, and that can cause significant pain. And then you also now have heavy menses during this time. So for such patients with adenomyosis, they definitely need follow-up, because it affects them in a way that if you're bleeding, you have anemia, you have complications due to anemia. And then now, because of the pain, you have severe pain. Could be abdominal, it could go to the back. And then you have also issues with fertility, but most of the time you'll find women who have also conceived may have the adenomyosis. So the main treatment of adenomyosis, we don't remove it like fibroids, because they are like chunks. You can't remove like a whole ball like a fibroid. So we don't go trying to remove parts of adenomyosis, try and remove the whole uterus. That's if the lady is happy with their family size. Like you've conceived, you're like, okay, I'm done, this is okay, we can remove the uterus. But now if you haven't, it means those tissues are still there. We can manage the symptoms and try to reduce so how to manage the symptoms is to stop the bleeding. So there are medications we give to either stop that bleeding, or that cycle that you have every month. So you still have the tissues, will still be there. We've not removed them, but at least we remove the symptoms of that adenomyosis. For whether we have trained as a standard
I know it's touching Dr. Kireki,
yes,
and the association.
This is why they train us every day.
I think I can take that.
Yes, please.
I'll take that without any problem. First of all, Paul Asana, that she had to go to hospital, 36 weeks with high blood pressure, and unfortunately taken to theater after 4 days. That is very unfortunate, because from the question, it sounds as if it's something we call preeclampsia, whereby during pregnancy the blood pressure shoots. Sometimes you are swollen, the patient is swollen, or sometimes she starts losing protein in the urine as well. Sometimes you have one of these symptoms, or you may have all of them, and this can affect both the mother and the baby who is being carried, the fetus, as we call it. Now, at 36 weeks, I'm sure, and I hope that she used to go for clinic when she was pregnant, and I think that is where most probably the doctor caught the pressure that it had started going up, and that is why she was sent to hospital. Yes, there are standard operating procedures. First of all, once we have made that diagnosis, then we need to work quickly. At 36 weeks, the baby is reasonably okay and can actually survive without much intervention outside the womb. Normally what we do is once we got that problem, we want to try and make sure that the baby's lungs are as developed as possible. We give an emergency injection of what we call a steroid, so that the baby's lungs are prepared, such that when the baby comes out, we not have challenges with breathing. Now, at 36 weeks, after from what was put there, I think the right decision should have been 36 weeks. Pressures are elevated. The best thing is to get this baby out as soon as possible, because the biggest challenge or the problem with high blood pressure, preeclampsia, in pregnancy is what we call the placenta. The placenta is what connects the baby to the mother. So if there are problems there, we need to get it out. And once we get it out, the pressures will actually come down and everything should be okay. So pole sana for that. And we pray that she does get pregnant again and carries the baby to term.
Yeah. A question is just popping on my head. When the doctors delay, could it be you're trying to manage the pressure of the mother, or once you discover mother pressure is high, let's go to theater, we'll solve the pressure there?
I think there's so many things, there are many things which are interacting at the same time.
Yeah.
There is what we call the first delay, second delay, and third delay as well. The first delay could be at home. Should I go, should I not? And unfortunately, we find patients who come and we ask, when is the last time you felt the baby kick? Ati ilikuwa siku mbili zimepita. So we ask, kwa nini haukuja? Ati nilikuwa nafikiri itakuwa sawa. So that is the first delay. At home, that decision, let me go to hospital. And then now the second delay, there is an issue of from home to the hospital. Do I get transport? It's late in the night. Naogopa naweza nikavamiwa. I don't have transport. I live far away, and so on and so forth. That adds on to the problem. The third delay is when you are in hospital. You come to hospital and you find there are so many other ladies as well who are being admitted at the same time with different issues. And by the time you get admitted, you get assessed, and you come to see the doctor, and then there are other issues now. Sometimes we want to do that cesarean section immediately, but you find there is no theatre. We have 2 theatres in Kenyatta National Hospital, for example, which are working day and night. 2 theatres. So she may come and we find maybe she has to wait a little bit until we finish from theatre. So all these small delays can actually add up and become a problem later on. But most of the time we want to be as efficacious as possible and expedite this delivery as soon as possible.
Okay. And we say, Pole, be the Lord
say
heal
Pole
you,
again.
and may God give you that blessing again.
Yeah.
He's able to do it.
I
Amen.
wanted to add something
Yes,
else.
please, Dr.
When it comes to any medical condition as well, other than the delays, every treatment is individualized. Not every patient gets this. Of course, at the end of it, we want to have a healthy mother and a healthy baby. So when you come with high blood pressure, there's a difference between one person who is at 28, let's say you're at 24 weeks, and there's that one who's at 36 weeks. There's a big difference. So sometimes it's good to have conversations with your doctor. Ask them, what am I doing? What are you doing? Why am I still here? Why do I still have my baby? So it's good to ask. You have a right to ask the doctor questions.
Absolutely.
Okay. Okay. Before we wrap up, I want to know if there is an issue. Where do I take my complaint? That is before we wrap up. Please, damu yangu ya mwezi iko na miaka 2 bila kukuja. Please nisaidieni ikuje. Miaka 2 damu yake haijakuja. Tufanye aje na huyu? Tutajaribu Kiswahili kidogo.
Kiswahili, okay. Wow.
Afanye aje mtazamaji?
I thought I would have skipped the Swahili. Kwa hivyo ukiwa imekaa kama miaka 2, hiyo ni imekaa sana. Lakini ni muhimu ni umwambie anafaa kuonekana na daktari kwanza, kwa sababu yeye kuna vitu tunamuuliza maswali kama hizo mambo za jina, mali ametoka, kama kuna shida yoyote ya thyroid. Unajua hii thyroid akwa hapa mbele. So hizo vitu zote zinaweza kufanya hiyo shida ikwe. Pia hata ile contraceptive ama family planning yenye anatumia, kama ni ile ya ine inadungwa, inaweza kukaa mpaka hiyo 2 years kama hajapata period. Kwa hivyo kuna vitu nyingi zinaweza fanya, ama labda ameingia menopause. Atujui miaka yake. Lakini ni important, lazima aonekane kwanza ndo tujue kama ako sawa kuanzishiwa hizo period ama labda kuna shida nyingine yenye haijatatuliwa.
Sasa tafadhali mtazamaji, kimbia muone daktari. Daktari anaitwa gynecologist. Sawa. So one more here before we get to something else. So many questions coming through. My wife had 5 years family planning. Kwanza, we appreciate you, gentlemen, for writing. And says, my wife had 5-year family planning control injection. Amekuwa normal before injection, but after that, imekuwa abnormal, such that she goes for almost 2 weeks. After that, it breaks for 1 week, then comes back. Hapa kunaenda aje, daktari? Kunaenda aje hapa?
Hapo kunaenda hivi. First of all, asante sana that he has taken that responsibility. Amewajibika na anaona kwamba mama yuko na shida na ameandika kusudi kutafuta usaidizi. Now, when you take contraceptive pills, hormonal contraceptive pills, for a long period of time, it can be either tablets, it can be the injection, vile amesema alikuwa anatumia sindano, for a long period, or you can have an implant, you know, which can stay there. Some use it for 10 years, 15 years, and so on. It disrupts the normal body function. So when you stop using the contraception, the body has to take time in order for the signals to reach the brain so that the body can start working again. Now, once the body has started working again, it may reach somewhere because of that very long time without functioning. Normally, it sort of gets distorted. Tunaendelea ama tuendelei. So now that one, ngelimshauri apeleke mama kwa daktari, aje apimwe, tumpige picha, tumpime damu, alafu ndipo tutamsaidia.
Okay.
Hapo naendaga hivyo.
Kunaenda hivyo kaka.
Yeah.
Tafadhali, take your wife for a check-up. Doctors will be glad to hear you. A few more. I have breast pain when I want to attend my period, even my back pains. Is that normal? Breast pain and back pain.
Just before the period?
Yes.
Yeah, there's something called premenstrual syndrome, or premenstrual symptoms that some people, not everybody, but most of us will experience some level of changes in your body because there's a hormone called progesterone. It drops suddenly, and once it drops, then there's changes in your body, which cause now you probably have some mood changes. That's when you get upset with your boyfriend or your husband just before your period. Then you also you tend to have some feeling of engorgement in the breast. So it becomes firm, tight, and also very painful. It might even be the only symptom before your period. So every time you have a breast pain or breast tenderness, you know that your period is coming in the next couple of days. So, and then of course now the other things that happen to your body, some people have some pain before the period comes in. But again, it's good to note that if you have this severe pain just before your period, it might also be a sign of endometriosis. So not to ignore pain, but it's possible to have a few mild to moderate pain. It can happen. Other things, there are people who even they're likely to get infection, slightly, the fungal infection just before your period as well. So those are the kind of things that can happen. If they are severe, then get us on board so that we can help. Because there's some who get things like mood changes.
Yes.
They go again to depression or even anxiety just before your period. So if you feel like you're deranging beyond what you can control, then you need to see a doctor.
Okay. One last one, then we talk about, I promised to have an announcement to make.
Yes.
And we need to do that before my director says we need to wrap it up and go home. I have had 2 ectopic pregnancies. Is it advisable I remove reproductive system because I believe they wanted to say fibroids, not vibroids? Yeah, fibroids, yes. Can they do that?
A patient can actually ask to do whatever she wants, but will it be okay or will it be okay? Some of the things that we need to know is how old is she? How many children has she delivered? Has she finished, having the family size that she wants, and so on. An ectopic pregnancy is a baby developing outside the womb, where it is not supposed to develop. Most of the time, they end very early at around maybe 7-8 weeks, because most of the time they start bleeding. So I think that is why she had 2 of them removed, and most probably they removed the tube, because most of the time they actually grow in the tubes.
Okay.
What we don't know is whether both tubes were removed or it's one tube which was removed, but that is a detail which she can give us. When it comes to fibroids, again, it depends how big they are, where they are located. Does she have symptoms? when she's having her periods? Are they very heavy? Are they clotty? etc, etc. We need to know all this. So once we have got this information, then we can give her options. Option number one, tumia madawa, and then we see you after a certain time, 3 months, 6 months, and we see whether the medications have helped. If the medications haven't helped, you can try something else. Contraception, for example, block those periods, block the ovaries from working, and see how you feel. Ikiwa bado hiyo haitafanya kazi, now we can come and sit down and say, now, these are the options for surgery. Now, surgery tunafanya 1, 2, 3, 4, 5, 6, and so on and so forth. So it should be something which we should discuss, and then we come to a decision together, the patient with us, the doctors.
Thank you. So let's get to the great announcement. What's happening this weekend?
Now I'm excited.
Yes.
So this weekend, on the 27th of May 2023, we're going to hold our walk. This is by Dr. K Foundation. We also have COGS who also partner with us. And it's going to be about menstrual hygiene and menstrual, again, we're talking about menstrual shaming. So it's going to start at 7 a.m. to 1 p.m. at the University of Nairobi grounds. That's a graduation grounds. And we will do a less than 5-kilometer walk. You know, some of us prefer to walk very short distances. A 5-kilometer walk where we're going to, you know, spread awareness on menstrual hygiene. Then after that, we're going to have a menstrual hygiene talk. We'll talk about the different products that are there. You know, we have pads, we have tampons, we have the menstrual cup, we do have reusable items like pads that can also be used. You know, if you can't buy pads every single day, then why don't you consider getting something that you can reuse and also protect the environment from toxins and all. So we want to inform people about these products that are there. And then we're going to have fun, eat something, you know, play games, giveaways. So we welcome everybody. They can find us on Dr. K Foundation on Instagram, which is dr.k foundation _, and my Instagram is Muthembwa. You can also find us there, and then you'll find more details on the work. Everyone is welcome, not just women and girls. Even Dr. Kireki is with us.
Yeah, COGS is a supporter,
yes,
a serious supporter, because I think this is something which is very important.
Yes.
And gentlemen, come, let's support Kabisa.
Yes, yes. So all you need to do is get a t-shirt, which is 1,000 shillings, and 2 packets. Just 2 packets of pads. Hata ukikosa hiyo 2 packets, kuja na moja. If you can come with more than 2 packets, come with 10, come with 100. We'll be so happy. We'll be giving them to Wings of Hope, where it's a rescue home for young teenage mothers who have just given birth. They need pads every single day. And Daraja Academy, which is in Laikipia County, where they help underprivileged girls in high school, and they teach them for free and also give them pads for free.
Okay.
Yeah.
Is there a number I can call? Maybe I'm in the US, cannot be able to make it this Saturday, but I want to give.
Yes.
Or I want to donate, to give the pads, to get the t-shirt, buy t-shirt for a friend.
Yes.
How can they do that? Maybe a number they can call, an email?
Yes, it's on my Instagram page, Muthembwa, and also the Dr. K Foundation. You can also find us on email. It's drk_21 at gmail.com.
Dr. K under 21.
DRK under 21 at gmail.com.
Thank you.
Yeah.
And of course, Hope Media is a proud sponsor to this walk. Please come. Let's go walk and support our women in our lives. As we wrap it up, I promise. So if a patient has any complaint, you know, Dr. Kireki, regarding, I was treated this way. I went, I was okay. My baby heartbeat was beating, and then something happened. Where can audiences place that complaint?
In every hospital, there is a complaints and compliments book. If it's in labor ward, there is a compliments and a complaints book. So they should actually write that and say, look, I came here, this is what happened. Of course, it cannot be anonymous. Put your name there, the date, and the time even the better, and then sign. That is one way. The other way is that you can actually lodge a complaint by writing a letter of complaint to the head of department. And the head of department now will come and work on it and can actually escalate that complaint to the management, right up to the CEO of the hospital, who will take up this issue and then go for it. The other option, if we feel like maybe the hospital has not done what it is supposed to do, we have another mechanism, and that is writing a complaint to the Kenya Medical Practitioners and Dentists Council. You write and say, I went to a certain hospital, this was my case, this is what happened. Of course, your name and the date this happened. The council can form or does call a committee which will ask the hospital to furnish it with the documentation.
Yes.
Then they will actually form a committee, and they will call you as well, and they will call the people who are involved, and then they will decide on the best way forward. So there are different ways of sorting this out. And then lastly, there is the court. You can hire a lawyer, and then the lawyer, because this is what they do, they can also lodge a complaint and take it up in the judiciary.
Okay, thank you so much. I want to appreciate you, Dr. Kireki Omanwa, together with Dr. Karen, for joining us. And of course, this weekend we meet at University of Nairobi.
University of Nairobi graduation at 7 a.m.
Come with sports shoes or stilettos.
If you can walk with stilettos, all the best. We still welcome you.
Yes, and
but you are comfortably.
Comfortable.
Yes.
And a packet of pad or two.
Yeah, a packet of pad, 2 pads, even more than 2 packets of pads.
Okay.
Let's help our young girls all over the country.
Thank you.
Yeah.
Thank you so much. It's an honor to serve with you. God bless you so much.
Thank you so much.
Excellent work you're doing.
Asante.
Amen.
Asante.
And for you, our viewers, we really want to appreciate you for joining us in tonight's edition of Health Check. I hope you've learned, especially the men who are tuned in. We appreciate you. The ladies who are tuned in, we appreciate you. And for the many questions that have come through, we apologize we could not be able to get through to all of them, but we promise we'll pass them to the doctors and they'll be able to see how to reach out to you. My name is Grace Mutisa. I wish you a blessed time. God willing, let's do this again next week, same time, same station. Of course, different topics, different guests. It's a time for us to learn about our health. And for you watching us, and maybe you lost a child or you're at that place of waiting, imagine God still loves you and he'll come through for you at the right time. So do not lose hope. Visit a doctor. God bless you. See you next week. Bye-bye for now.